Good afternoon. My name is Sarah Nazashuri, and today I will be discussing how to implement MyChart to improve patient access to medical records and healthcare history. So let's get started on the agenda for this project. We will be discussing what problem the innovative project will solve, what is known about the problem, who I collaborated with while working on this proposal, what mobile app did I propose that would solve the issue, and why is the proposed solution innovative? So let's get started with what problem will the innovative project solve? This innovative project solves the inability to access medical records and health information. So what is the problem? Everyone has the right to access their medical records and health history according to HIPAA laws. So when individuals don't have access to medical records, it means that they're not fully able to understand their health history, which then means that they cannot make effective choices about their health. So it's important to have access to your medical records. And who's affected by this problem? All patients who seek healthcare services at a facility or office where electronic medical records and online platforms are not offered are affected by this issue. What would be different? All individuals would have access to their medical records and to the platform to make better and informed healthcare decisions. What's known about this problem? So some background and significance on some medical record laws that already exist. A patient or patient representative is entitled to copies of all or any portion of their records, and they have the right to inspect upon written request to the physician. Now, the physician can charge a fee to offset the costs of paper, not to exceed 25 cents per page. And by law, a patient's records are defined as records relating to health history, diagnosis, condition, or treatment provided or proposed by the physician to the patient. And the physician must provide copies within 15 days of the receipt of the request. And this is from the Medical Board of California. However, the law only addresses the patient's request for copies of their own records. And it doesn't cover a patient request to transfer records between providers or to give to an insurance company or an attorney. So this means that the transfer of medical records is seen as a professional courtesy and is not covered by law. And some statistics, actually over 90% of healthcare systems now offer patient portals to access electronic medical records as of 2021. And this can be due to post-pandemic and the shift onto telehealth. But only 15 to 30% of patients actually use the platforms that are offered. And you can see this graph, which shows over the years how much there has been a shift of hospitals and office-based physicians to online healthcare portals. Nearly 100% of hospitals now have it. So some professional literature regarding this issue. Electronic health records were first actually developed to manage clinical information, not to engage patients. However, patient access through their EHR data through either online portals or mobile applications can be seen as a potential tool for improving engagement. Common features of online patient portals can include the ability to view visit summaries after an appointment, test results and lab results, immunization history, allergy lists. Also, they have secure messaging between physicians, appointment scheduling, and even medication prescription renewals. There is a substantial demand from patients and patient caregivers to access electronic healthcare record data and to communicate electronically with health systems. So what are some other solutions that were proposed and why were they ineffective? So HIPAA, the privacy and protection laws, were first introduced in 1996, and the reason why HIPAA is ineffective is because it provided basis of the law, but no motivation to actually propel technology forward. So what encompasses HIPAA? So with limited exceptions, the HIPAA privacy rule provides individuals with a legal and enforceable right to see and receive copies upon request of their information. So similar to what we talked about before regarding the laws. It requires HIPAA-covered entities to provide individuals with access to their protected health information in one or more designated record sets. This includes the copy to inspect, PHI, and transmit a copy to any person of their choice. And this is maintained in paper or electronic systems on-site, remotely, or archived. So this was in 1996. There was another solution called HITECH in 2008. So the HITECH Act actually encouraged healthcare providers to adopt electronic health records and provide security protections of healthcare data. And how this was achieved was through financial incentives for adopting electronic health records and increased penalties for violation of the HIPAA law that was before. So it incentivized the meaningful use of electronic health records and strengthened the privacy through HIPAA. Now they were accountable for failures of HIPAA compliance. And there were 5 goals of HITECH, which was to improve quality, safety, and efficiency, engage patients in their care, increase the coordination of care, improve the health status of the population, and ensure privacy and security. So actually prior to the HITECH Act in 2008, only 10% of hospitals had electronic health records. Now we know the most recent statistic is around 90%. But why is this ineffective? Well, it didn't provide the means, just the support and payment. The HITECH Act gave a financial incentive to adopt the electronic health record, but it did not offer which health records to adopt or which health record is the most efficient, is the most widely used. So it just didn't provide the means, but it provided the support. So who did I collaborate with while working on this proposal? I collaborated with 3 different individuals. First, we'll discuss EH, who is a medical doctor and a practice owner. So why did I choose EH? So he's a medical doctor, and as a private practice owner, he can influence the widespread adoption of the innovative project. He also provides a unique perspective on the adoption of MyChart, since his own clinic doesn't actually utilize the software for MyChart. He does have another online health record, though. He explained that the reason for not having Epic as its EMR is that it's due to the financial cost of adopting it. He uses a smaller company, but reports having trouble with using that interface. He also describes that when he refers his patients to other specialists, his patients reference the MyChart notes from those encounters. So he understands how much assistance MyChart provides for patients, but due to the cost, he cannot adopt it at this time. So what did he recommend? He recommended that I focus on laws regarding accessing medical records for the development of the project, which is what we discussed a little bit earlier in the background and significance portion. Next, I chose AS, who is a patient and a current MyChart user, and the reason I picked her is because her healthcare can potentially be very affected by this project. And her perspective is unique because she currently uses MyChart to manage chronic illnesses and autoimmune diseases that she has. She explains that she's very happy with the adoption of information technology in healthcare. She has been going to the same hospital system and medical group for over a decade, but they only adopted Epic and MyChart around 2019. And she mentions that when she gained MyChart access, that things became much easier for her. She's able to access her lab results, appointments, get estimates for copays and medical bills, which was another important factor for her. Most importantly, message doctors on the application and get a response within 24 hours. She doesn't report any downsides regarding financial cost because the application is free, and she has not, to her knowledge, been suspiciously charged for asking questions or messages to her doctors, which was a concern for her. She also mentions that almost all of her providers have adopted MyChart at this point, even her dentist. Only mentions that an ophthalmologist was not utilizing MyChart. But what she recommended for the project was to research the availability of MyChart access versus the number of patients who utilize it, which was discussed in the statistics section, where we described that 90% of hospitals have adopted electronic health records, but only 15 to 30% have accessed it. Lastly, I spoke with AJ, who is a marriage and family therapist. So I chose the marriage and family therapist because he can provide guidance to maybe social or ethical issues of using MyChart. And his unique perspective is that as a therapist, he mentions that his therapy notes are considered mostly confidential. So this is interesting. He states that in his profession, patient access to therapy notes can actually cause harm to the patient and disrupt the therapeutic process. Therefore, most notes are kept confidential, and it's up to the discretion of the therapist whether it's harmful to reveal it or not. He explains that if the patient will read about the therapist's therapeutic plan or read about, the certain defense mechanisms that they use, they may regress in treatment or become aware of goals, and it promotes them to act inauthentically during the rest of the therapy sessions. So what he recommended was to become knowledgeable on laws regarding therapy note access and confidentiality. And there are some notes, actually. This doesn't just refer to therapists refusing to give medical records, but a physician can refuse a patient's request to see or copy their mental health records if the physician determines that there is a substantial risk of significant adverse or detrimental consequences to the patient if access was permitted. And this is from the Medical Board of California. So, in order to not give permission to mental health records, the physician has to make a written record and include it in the file, noting the date of the request and explain the reason for refusing to provide the copies. The adverse or detrimental consequences that they anticipate would occur if they were able to look at their record. And the physician must also permit inspection or copying of mental health records by a psychologist, marriage and family therapist, or clinical social worker designated by the patient. These healthcare providers also can't give these copies to the patient as well. Lastly, if the doctor is refusing to permit the inspection of obtaining copies, they must let the patient know. And they must indicate in the records whether the request is made to give a copy to another healthcare provider. So these are just some laws regarding this aspect, and it was very interesting to actually read. So knowing all this, what mobile app can solve the issue to increase access? We kind of spoke about it a little bit, but that app is called MyChart. So MyChart is a mobile application or a desktop website which provides access to one's healthcare information and proves a direct connection to a doctor. So what MyChart does is that it synthesizes data from Epic. Epic is an electronic healthcare record on the provider's end in which they log in their clinical data, and it allows the patient to view the health record on their device through MyChart. So by utilizing Epic as the primary electronic healthcare record system, it becomes streamlined onto one platform. So it not only benefits patients who can see various providers and specialists, but those various providers are also able to view the full health history of the patient as well. So how does it solve the issue? So as mentioned above, MyChart solves the large problem on both the provider's end and the patient's end when it comes to accessing medical records. Remember how we spoke about the law where it says that it's just a professional courtesy to transfer records from one provider to another and it's not protected by law? Now with MyChart, the provider is able to access the health history of the patient as well, eliminating that aspect. Also, patients who can't access their medical records might not fully understand their health history. And when they're proposed with treatment options, they might not have all the information necessary to make that decision. Various providers that use the same platform makes for effective documentation and knowledge of the patient's health history. For example, let's say a patient goes to see a primary care doctor and that situation requires a referral. Then the patient goes and sees a specialist. The specialist is able to read why the primary doctor referred them. And then later, after that specialist visit, the primary care doctor can read what the specialist findings were and to coordinate care. And while all this is happening, the patient gets real-time access to the medical notes and the after-visit summaries, informing them of all the doctor's assessments and their diagnoses. And the same applies to a patient visiting a new doctor. Let's say a new doctor doesn't utilize MyChart or Epic. They can log into their MyChart right there in front of that provider and tell them, my diagnosis is this and that. My doctor said this, so that's why I'm here. Access to medical records empowers patients with knowledge about their health, which allows them to make better informed decisions. The app provides the ability to schedule appointments, send messages, view lab results, diagnostics, pay bills, read doctor's notes, and much more. And the app is highly innovative. It's highly innovative in the sense that it's a big part of emerging information technology in healthcare industry. So much that the Healthcare Information and Management System Society, or HIMSS, aids in promoting best IT practices in healthcare. And being designated a HIMSS Stage 7 is the pinnacle of technological advancement. So it's no surprise that Epic is adopted in around 82% of HIMSS Stage 7 clinics. So, why is this solution innovative? We touched base on that in the last slide, but in summary, it's innovative because accessing medical records from various providers electronically from one single portal is innovative. It removes the hassle of requesting records, waiting for a fax or mail, not charging per page, not waiting the 15 days that the provider has. Also, electronic systems are innovative, and they follow the trend of increased telehealth visits outpatient post-pandemic, or telehealth. I found 5 principles of innovations from the Center of Creative Leadership. So we will be going through all 5 principles and acknowledging how this project meets each principle. So first, innovation starts when people convert problems to ideas. So new ideas are born through either problems or new questions. And in order for the process to begin, it needs to have a climate that encourages innovation and inquiry. So, how did I implement this? So I did identify problems such as difficulty accessing medical records, cost, time, and the necessity and importance of having this access so that patients can make better informed healthcare decisions. Second, innovation also needs a system. So all organizations have healthcare or have innovation systems. Some are formal, some are informal, and systems for innovation can fall into several categories. So the MyChart application utilizes Epic EMR system, which is a system that is in place at various medical institutions. We talked about how it's in 82% of HIMSS Stage 7 clinics. So that's the system in which the innovation exists in. The third principle is that passion is the fuel and pain is the hidden ingredient. So passion propels ideas and is what transforms resources into profits, but sometimes there can be issues regarding cost. So for this innovative project, it is important to understand that it can be difficult to make all practices implement Epic and MyChart due to high costs. So that is something that I acknowledge as well. The fourth principle that underlies the methods for innovation is that co-locating drives more effective exchanges. So though it's not always possible to, exist in person and collaborate, it is important to engage in creative thinking and critique of ideas and work together effectively for the innovative project. So the way I implemented this principle was that I collaborated with 3 individuals with all various perspectives: a doctor, a therapist, a patient. Lastly, differences should be leveraged. So the differences such as language, culture, and problem-solving styles can actually contribute to innovation as well. And going back to the collaboration phase throughout my project, the three individuals came from varying backgrounds and different problem-solving styles, and they all provided different feedback, which was taken into account in developing this innovative project. Next, I will be presenting my references. You can refer to the references here. And I thank you so much for listening to my innovative project presentation. And I hope you have a great day. Thank you.